So now you're switching over to the guided surgery. Walk me through what's happening there. So now you've used this little corn cob connects to your piece. Talk to me about guided surgery. Let's step back. Before we get into the specifics of the XNAV, what is guided surgery?
This one we call it, okay, guided surgery. There is the static guided surgery and dynamic guided surgery, okay? Dynamic, it means it looks like GPS kind of.
Okay.
So it's not just template, it's inside the mouth and I'm just following the holes inside this template. This is more of dynamic, so I'm still using my hand to do it, guided by this software. So like I see the angle as I planned before the surgery, where I need exactly to be centered, angulated, going through life. I mean, using my hand, actually not using a template.
Right.
That guide the drill. Let's
Right.
say.
So basically what I've seen the guided before is they'll print something that has holes in it, preset holes that you just basically drill through those holes. That's one, that's the static. And you're saying the dynamic is you're still freehand, but you're using technology to help make sure that its accuracy aligns to how you planned the case from the beginning.
Plus, if there is anything happened during the surgery, you lost part of the bone, if you are static, you're stuck.
Oh, that's a great point.
You can't change plan. Over. So all these templates you have been prepared before, it's gone. If anything, and it happens a lot when you, I mean, it's not 100% guaranteed that what you're planning will go exactly as you do it.
What?
This is luxury, like no.
Yeah.
Sometimes you see things that you need to change the plan. Simply, I just go, while I'm there, change a few things here and still go guided and see exactly where I can go. More flexibility.
Okay. So now we got guided surgery understood. Talk to me about this technology. So like you said, it's kind of a GPS. It sees my mouth from above, right? With, how does it get the markers? Like explain to me how this works.
Okay, two ways to do this one. One of them we call it the XNAV and one of them we call it XMark. Okay, XNAV, you see this clip that you had, right? This one you already had it before the surgery, right? We took CT scan with it before. And then during the surgery, as you just did now with your cameras, you calibrate the handpiece to this camera on top, to this clip, 3 connected. Then when you go with the drill, you can see exactly where your drill going in the X-ray.
Okay.
This calibration things.
Okay.
This one way to do it. Sometimes we don't have this luxury that patient has teeth at all.
So edentulous completely,
Edentulous.
yeah.
So the other way around it, sometimes they have to come also before the surgery to install small, like 3 or 4 titanium markers inside the bone under very tiny local anesthesia, and to take the CT scan, which will do the same thing at the surgery.
Okay. It will act like the other would.
Same thing
Okay.
to connect the 3 dots, the camera, the handpiece, and this device.
You and I have been, you've been my dentist for a long time, but
Lucky me, huh?
wow. Yeah, we're gonna cover that subject at some point. What a patient I was. He used to have hair before I met him. All of it's gone now because of me. But no, seriously, because I've gotten to see you grow as a specialist in this, there was a time, and you were really good at it, at just freehand. You were able to do freehand really well. Then you moved to this technology. Why? How has it helped you as a clinician?
It's mutation. Imagine yourself working now without your smartphone. Can you?
Be tough.
Nowadays, be impossible.
Yeah.
Before this one, actually, I said like, why I use it? I feel comfortable doing it.
Yeah.
It's just tried it once, twice. I feel like why I didn't use this long time ago. I missed a lot. of comfort, of accuracy, of confidence, just like going there without even worried, did it go right as I expected or no? This is just put the errors aside.
Nice. And I mean, it's a sizable investment. And one of the things that I always encourage our viewers, we have it in one of our handouts of when you're doing your consultations, ask a clinic, when you're calling on the phone, ask them what kind of technologies they've invested in, because I know how much these technologies cost, and dentists are notoriously cheap, honestly, and yet you want to find somebody that will invest in technology to really, like he said, remove the errors. So now you've got a whole grip, a whole bunch of things that can go wrong with this. How do you mitigate that risk for them to do their job properly? By technology is a great tool to help out with that. So, I mean, I don't know if you guys are seeing this, but I mean, that's amazing to have that kind of crosshair pinpoint for him to be able to see multiple views, angulation. That's pretty cool.